Hello, I am Dr. Nischal. I am practicing at Nirmal Skin and Hair Clinic in Vijayanagar, Bangalore. The treatment for baldness depends upon the severity of the baldness, the rapidity with which it is progressing, and overall general health of the individual. Treatment starts from tablets, solutions, and procedure. So it's a combination of these three things which is going to give best of the result. Solutions for the hair fall treatment has to be a continuous process because it's a hormone triggered condition and hormones are always there in the body. It is there 24/7 and hence any treatment or therapy to reduce hair fall has to be continued till the time an individual wants a good result. In the initial phase, depending upon the severity, either a solution alone is started, it's a topical application, or we combine that with internal medications. Whenever we see there is a nutritional deficiency, for example, it can be a iron deficiency anemia, or it can be vitamin D deficiency, or it can be vitamin B12 deficiency. Any medical illness or deficiency has to be rectified for the best results. And often we do test for these deficiencies before starting the treatment. Solutions which are given to improve the hair fall or the baldness either improve the blood circulation, they improve the growth phase of the hair, or they act at cellular level. Okay, these medications are called as peptides. We do mesotherapy where medications are injected into the scalp, Derma roller is done, platelet-rich plasma is done, and also iontophoresis is done. See, these are the treatment which are chosen based on the severity of the hair fall and the improvement what we require. In iontophoresis, the medication is applied on the skin and a galvanic current is passed. These galvanic current, they push the medication into the skin. So the delivery of the medicine is better, the results are better. In mesotherapy, medications are injected into the skin. The depth of penetration is much better when compared to iontophoresis, so the results are better. When an individual presents with severe hair fall, mesotherapy is done weekly once to arrest the hair fall. Usually about 4 to 6 sittings brings the hair fall under good control, and then the hair growth is maintained or it's improved using other treatment modalities. Derma roller is a very cheap and a very innovative treatment option where we tend to stimulate the stem cells in the hair follicle. These are safer because the stem cells are stimulated in vivo, means we are stimulating an individual's own stem cells rather than putting it from outside. So the safety is much better. Second, whenever we are doing a derma roller, there is a prick to the scalp and we apply some active ingredients. So the actives go into the skin. So there is a benefit of stimulation of the stem cells. There is also a benefit of better delivery of the medication. These procedures are repeated till the hair fall stabilizes and a good improvement is seen. Platelet-rich plasma is a treatment which is popularly called as a vampire lift, but this is not only used for a facial rejuvenation but also for the hair. What is the logic? Platelets are rich in growth factors, and as you all know, platelets are a cell in the blood. So these platelets which are loaded with the growth factors are separated from other blood cells and they are injected back into the skin. So when these platelets which are injected into the skin release the growth factors, the hair growth is promoted. So these growth factors rejuvenate the cells. So the dying cells, the poorly functioning cells, they start getting rejuvenated and functioning better. So this improves the hair growth. And since it's the individual's own blood, there is no risk of any infections, any allergies, and rather these molecules have found to have antibacterial effect. It's a very simple and easy technique and very beneficial technique as well. What do we do when an individual has lost significant number of hairs or he wants to cover one small patch which are happening in the corners of his front line? So in those situations, they need transplantation. So hair transplantation is a technique where follicles from the backside of the scalp are removed and put into the front. Since they are implanted into the skin, they tend to grow naturally. It is just like you pick a plant from one area and you plant it in a different area. So it retains its properties, it grows into the skin and it divides, or it grows naturally as before. Commonly, we put people on supplements, a biotin supplement, iron supplement depending upon the deficiency, or even vitamin D preparations. These supplements have to be taken for about 6 months to 1 year based on the improvement of the hair growth or the arrest of the hair fall.